Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, Hafaday, my friends, and welcome back. This is Healthy Living right here on KUM News Extra, and Dr. Jitka Lom is here, as she is every Tuesday. And tonight we are talking about sleeping problems, specifically jet lag and insomnia. Let's go ahead and get to your questions. You ready?
Yep.
Okay, so our first question comes to us from somebody that posted on our Facebook wall, Linda G. from Jonia. So Linda, thank you for your question. And Linda writes, when I have trouble sleeping, I usually take a sleeping pill. Now, should I be concerned about any long-term side effects? Sleeping pills.
Yep. So the main thing is how often is she taking it and what kind of drug is this? Once in a while, many people can use a sleeping medicine and it will not give them any kind of long-term side effects. We want to make sure that she's not getting hungover and having excessive drowsiness in the morning, so she'll be dangerous driving her car around. The other thing with it is that to make sure that she's not developing two things. One is tolerance and the other is dependence. Tolerance is when you need bigger and bigger doses of medicine to give you the same effect. So instead of taking one sleeping medication, she'll end up with 2, then 3, then 4, end up a drug addict, okay? The other is dependence, where she just can't go to sleep without her medication, and that's also an unfortunate situation to be in. So with caution, once in a while, getting back to the whole issue of sleep hygiene and a healthy lifestyle.
Okay, is melatonin considered a drug? I know that's been prescribed by, you know, natural medicine people.
Right, and that's an excellent question. Melatonin is very helpful. It is a synthetically produced hormone, which is produced in our own bodies by our pineal gland. The pineal gland is a little tiny gland in our brain that has to do with sleep also. So melatonin is a natural substance, and it is harmless and fine to try. Some people like that.
Okay.
It's not addicting.
All right, good tip. Okay, let's go ahead to question number 2 now. Gentlemen, if you would, in the control room. This one comes from Mary S. She is from the southern village of Agate. They just had their mango festival, and she says, my 18-month-old constantly wakes me up in the middle of the night and cries for breast milk. Is that necessarily a sleeping disorder, or is he just hungry?
So many possibilities there.
That's a tough one.
Yeah. He could just be hungry. He could be experiencing some stresses in his life. Have they just moved? Have there been some caregiver changes? You know, he may be hungry, so it's important to make sure that he's getting a nice bedtime snack, but brushing his teeth before going to sleep. And you might just give him a bottle or a glass of water that he could have when he wakes up instead of the breast milk if she's trying to wean him.
So babies that young can actually have sleeping disorders?
They can.
Wow.
They can. Actually, they can even have sleep apnea, young children, if they're very obese or if they have some nasopharyngeal problems where they're not taking in air properly, they can.
Okay.
Yep.
All right, good tip. So question number 3 comes from Louisa T. She is from the Capital Village down in Agate, and she says, my husband snores really loudly at night. I'm sure a lot of people out there have this experience. She says, we've tried things like nose strips, but nothing seems to work. Doctor, please help.
Oh, well, snoring, people make fun of it, but it's actually a serious health problem. Excessive snoring, we know, leads to high blood pressure. It leads to diabetes. It's associated with obesity, of course, and lower quality of lifestyle, not only for the sleeper, but also for their co-sleepers in the same bed. So to help him, we have to think about all the different things that may be causing the snoring. If there's problems in the nose or in the upper throat, those can be allergic. So making sure that his allergies are controlled. Second problem would be, is he drinking too much alcohol? Is that why he's knocking out and snoring so loud? So maybe that is something that he needs to address. But the most significant disorder would be sleep apnea. And the full name of that is obstructive sleep apnea, where during the nighttime people basically collapse down their throat and the back of their oropharynx, the back of their mouth, and they block off their own breathing. So they're basically making sounds like that, and
you're choking, essentially.
Choking,
okay.
Yeah. And if you think of it, that choking is awakening them. They don't remember it, but it is awakening them many times an hour. Sometimes 20, 30 times an hour they will be awakening. So imagine if the phone was going off 30 times an hour during your sleep, you would never feel rested in the morning. And that's why people with sleep apnea will feel exhausted, they'll have headaches, they'll be grumpy, they will be putting on weight because their metabolism is so disrupted by this, and developing serious health problems. So really something very important for her to look at with her husband. Snoring is not a joke.
Oh, okay, so Louisa, I'm sure she appreciates that, so thank you on her behalf. Okay, Margie G has our next question. She's from Upper Heights, So again, from down south. And she says, I used to be overweight, but I noticed that since I lost 20 pounds, I sleep better at night. Why do you think that is?
Well, she may have had a bit of sleep apnea that has reversed because of her weight loss. She doesn't have as much big throat or much of a big throat anymore. And also she may be exercising, and that improves your metabolism and your overall ability to sleep at nighttime. So congratulations on her weight loss, and glad it's better.
Yeah, Margie, good for you. I'm glad to hear that. Okay,
Yeah.
So for our last question, this is something that we kind of dug up here in the newsroom. So there is a myth that if you are traveling in terms of jet lag and everything, that you want to stay away from red meat and you don't want to eat, beef, cattle products like that, because that actually really exaggerates the effects of jet lag. From a medical standpoint, does that hold any water?
I think with jet lag, preparation for your trip is important, making sure that you are well rested before you get on the airplane. As far as diet, you shouldn't overindulge, drink heavily, or eat rich foods for prior to your journey, so that you're not feeling sluggish before you even start. But as far as red meat, I'm not aware of any contraindications to that prior to try to prevent jet lag.
Okay, so we have our last question now. This one comes from Carrie T, once again from the South, so the South well represented on tonight's show. She's from Santa Rita. She says, is there a difference in the amount of sleep that my 19-month-old should get versus my 7-year-old?
There is. Little babies need anywhere between 12 and 16 hours of sleep, probably at that age group about 12 to 14 hours of sleep. Her 7-year-old needs about 10 hours of sleep. So that means that the younger child is going to need to have a nap, and the older child should be getting into bed by 8 o'clock at night so that they can get up and feel well rested in the morning.
Okay, that's a good word. Now, once again, can you just debunk this urban myth? What are the dangers of waking somebody up when they're sleepwalking?
I don't think that there are too many dangers, except that you may startle them and frighten them because they're in an altered state of consciousness.
Okay.
So being very, very gentle with them, not disrupting their current experience would be important, but guiding them back into their bed and comforting them if they do awake suddenly in a different place and in a different situation than what they remember would be good.
Okay, well, you can tell here we're into urban myths, and we've watched a lot of 80s movies and everything. So, Doctor, we greatly appreciate your insight.
You're welcome.
Okay, we'll see you again next
Thank
Tuesday.
you.
Dr. Lom will join us again next Tuesday, where our topic will be acne. It's a very important topic, so if you have any questions about acne or dermatology, make sure to give the good doctor a question. You can post it on our Facebook fan page at KUAM.com/Facebook. Please do, and tune in next Tuesday, and check us out online on our YouTube channel or KUAM.com, where the doctor will answer your questions.